Hello, my name is Carl Cooper, and I'm the project manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability. And this is our presentation, Health Insurance Jeopardy, Round 2, Double Jeopardy, Part 2, Mental Illness. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it is the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say that when a consumer is looking at plans on the ACA marketplace, it is like playing a game of Health Insurance Jeopardy. I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. For our Double Jeopardy categories, we are looking at some of the disabilities covered in our population-specific fact sheets. And today we're going to be looking at the issue of mental illness. So let's start with our $400 clue. Psychiatrist, psychologist, psychiatric or mental health nurse practitioner, mental health nurse, social worker, licensed professional counselor, peer specialist. The question, who are the type of providers that individuals with mental illness see? And in this instance, you're going to want to make sure that the providers that they are seeing on a regular basis are in the network of providers in the plan that they are considering enrolling in. Moving on to the $800 clue, antidepressants, anti-anxiety medications, mood stabilizers, antipsychotic medications, and stimulant medications. The question here, what are common drugs prescribed for people with mental illness? Once again, you're going to want to make sure that the drugs that they take are going to be in the drug formularies in the plans that they are considering enrolling in. And if you want more information about drugs and how they're handled in terms of step therapy and a lot of the different tiering that occurs with prescription drugs, I'd encourage you to check out our video on prescription drugs. Moving on to the $1,200 clue, cognitive behavioral therapy, dialectical behavioral therapy, cognitive enhancement therapy, psychodynamic therapy, individual psychotherapy, group therapy, and family therapy. The question here, what are some common therapies utilized by people with mental illness? These various therapies can be handled in many different ways by insurance companies, and you're going to want to make sure that the therapy that they use in particular is going to be one that's covered by their plan, and also that it's covered in a way that is not going to be too limiting for the individual, as many times there's limits on numbers of visits that insurance companies will put in place. And if the individual knows that they're going to need more than that, they may want to be considering another plan. Moving on to the $1,600 clue. Substance use disorders, heart disease, hypertension, and diabetes. The question here, what are common co-occurring conditions for people with mental illness? And once again, as is the case with a lot of different disabilities, the issue of co-occurring conditions can become a real issue. And you'll want to make sure that you're looking at not just the therapies that they use for their disability, but also all the co-occurring conditions that occur for these individuals as well. So not just making sure that their drugs for their mental illness are covered, but also maybe a heart disease medication or a diabetes regimen or some sort of hypertension medication, making sure that all of these are included in the plan that they are looking at. And finally, the $2,000 question, lack of network adequacy, limited provider networks, lack of parity in coverage, high out-of-pocket cost, wait times to see a provider. The question, what are common issues with mental health treatment in qualified health plans? And this is an ongoing issue that continues to occur with a lot of these different plans, that the network of providers is not adequate, and it's difficult for these patients to end up getting a visit with the provider that they need to see, or that their out-of-pocket costs are too high, or that they have to wait for a long time to be able to see the provider of their choice. And these are all issues that can be dealt with many times if you're looking at these plans ahead of time and making sure that you understand exactly what is going on for that individual and seeing how it's going to match up with the plan that they're looking at, and making sure that the network that's in the plan that they're looking at is going to be adequate to meet their needs. If you haven't already seen it, be sure to check out round 1 of our Health Insurance Jeopardy presentation, where we address topics such as prescription drugs, medical devices, rehabilitation and habilitation therapies, Medicaid eligibility, the summary of benefits and coverage, and mental health. Those can be found on our YouTube channel at the link provided on this slide. If you're interested in finding out more about the NDNRC, you can check out our website, www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our channel to get more helpful videos like this one. And if you're interested in learning about the other disabilities listed, be sure to check out the links in the description below to access those videos. Thank you.